Hi, I'm Dr. Chinelo Okoye, and today I'm going to be talking about chronic fatigue syndrome. Chronic fatigue syndrome is a medical condition where patients have fatigue that lasts greater than 6 months, has no identifiable cause, and is associated with cognitive difficulties. So things like problems with memory, concentration, etc. It's a diagnosis of exclusion. So what this means is that the patient will need to have a detailed evaluation looking for all possible causes of fatigue before the diagnosis can be made. Now, fatigue tends to be experienced in different ways by patients. Patients may experience the fatigue as difficulty maintaining or initiating activity. Some patients may say it's a difficulty with mental concentration and alertness. Others may say things like difficulty with just staying awake and alert, so they, things like being increasing sleepiness or even shortness of breath. Now, I want to shift gears and talk about some of the different causes of fatigue that will need to be ruled out before this diagnosis can be made. So one is anemia. We see this quite commonly in women who have heavy periods. And patients who may be losing blood for any reason. Along with anemia is iron deficiency. This is important because low iron levels are associated with difficulties with cognition and mental alertness. So your doctor will need to check your iron levels. And in fact, some patients may have near normal blood counts, but be iron deficient. Sleep disorders. This is a very common cause of fatigue. Disorders such as obstructive sleep apnea, narcolepsy, even insufficient sleep, and several other sleep disorders are associated with fatigue. Hormonal disturbances. There are a host of hormonal disturbances that are associated with fatigue. So in women, for instance, the perimenopausal period, menopause, premenstrual syndrome, polycystic ovarian syndrome. These are all associated with fatigue. In men, low testosterone or andropause in men as they get older is associated with fatigue. The thyroid hormone is also implicated. Patients who have hypothyroidism, which is where their thyroid hormone levels are low, can have significant fatigue. And in addition to this, patients who are already receiving thyroid replacement therapy but may not be receiving an adequate dose, these patients could also experience fatigue. Mental health. So mood disorders such as anxiety, depression, and other mood disorders are also associated with fatigue. Medications. Can your medications make you tired? Absolutely. Your doctor will need to do a detailed review of all of your medicines to see if there are any culprits that could be, eliminated, or maybe their doses could be adjusted. Vitamin deficiencies. So your doctor will ask you about your diet. For instance, patients who are vegetarian can be at risk for B vitamin deficiencies. This can be associated with fatigue. Vitamin D deficiency as well. We tend to see this in night shift workers or in elderly patients who don't get out much and who don't get enough sunlight. Substance withdrawal. This is another big one. Withdrawal from alcohol, drugs, caffeine, energy drinks. Withdrawal from these can cause significant fatigue. Health conditions. This goes without saying. There are a host of health conditions in general that can cause fatigue. Heart diseases, lung diseases, infections of all kinds, bacterial, viral, Lyme disease, etc. So your doctor will need to rule out all these possibilities as well before a diagnosis of chronic fatigue syndrome can be made. And finally is deconditioning. If you're overweight and maybe not getting enough exercise, you could be deconditioned. And this is also associated with fatigue. So, seeing your physician for a detailed evaluation is the first step in finding out the cause of your fatigue.